I think Mr. Pink is not just an exceptional case, I think he's an exceptional person.
Grahame Pink is everything you could want in a nurse. He is very compassionate, but also what strikes you about him is he's passionate about the job.
Stepping Hill Hospital, Stockport, Cheshire, scene of a continuing disciplinary inquiry into the conduct of Grahame Pink. A nurse at the hospital and a magistrate, he's suspended on full pay after publicly condemning what he says is inadequate care of patients there. He may lose his job.
All I have done for the last 12 months is to try and bring, first of all, to the management's attention, and now to the public's attention, that the elderly people that I care for are not being properly cared for. There are times when they are put at risk. They are being neglected. And I am not prepared to stand by and see this happen and let it happen.
Mr. John Knott, 0032267.
The national backdrop is a Britain where more people than ever are over 75. They take up roughly 1/3 of all NHS hospital beds.
I'm going to sit you up and then give you the tablet. Okay?
That'd be nice.
With the elderly prone to sudden and acute illness, there's an ever-increasing strain on the nation's nurses. Government reports show that in some hospitals there are simply not enough night nurses to perform essential tasks. Standards are already accepted which those who treat the old would never tolerate for themselves. Yet, though many insiders know how bad things are, they fear for their careers. Few, apart from Mr. Pink, publicly demand action.
One, two, three.
That's
it.
That's
Right.
comfortable.
Right.
Nice.
Your diabetes seems to be doing okay at the minute. It's quite under control, isn't it?
Yes, more or less, yes.
Nursing sufferers from acute illnesses like strokes, heart attacks and pneumonia is costly, time-consuming and often exhausting work. Stockport Health Authority, which runs Stepping Hill, is investing £500,000 in acute hospital services for the elderly in its district. A new acute ward opens next month. One indication, they say, that they do not neglect their responsibilities towards the old. Mr. Pink disagrees. He's a night charge nurse who has worked on 3 acute wards at Stepping Hill Hospital. Since being suspended, he's not allowed to work there. In a ward in a different hospital, he emphasised how stretched staff at Stepping Hill are.
When patients have got no relatives with them, and this can happen, and we know that they are near to death, we all feel we would like to be able to go and just sit by the bed and hold their hand. But I'm afraid very often this is not possible. We just haven't got enough staff, and we have so many other things to do that we have to leave the patients. And there have been occasions which I have found very distressing when I've just gone back perhaps half an hour later and found the patient is dead.
The authority says that if Mr. Pink finds there are not enough staff, he should call for help.
Well, the difficulty about that is if you are on your own in a situation, as I've described, looking after so many very poorly patients, you've then got to leave the patient you're with. This is the one thing you want to avoid doing. Even just to go to the phone and to bleep for the night nursing officer or the sister and wait for her to reply and give the message, that could be 30 seconds, possibly more likely be much longer, 2 minutes. Now, that's a long time. Anything can happen. And the one thing you don't want to do is to leave the patient.
Initially, Mr. Pink voiced his concerns in private letters to the hospital authority.
On one night on C5 ward, there was just one nurse and one auxiliary, which is the normal staff for that particular ward, with 20 patients. This, remember, is for 11.5 hours. And they were so busy that night, even though they knew that there were a number of very, very poorly patients. It wasn't until the lights went on in the morning that they realised that 3 patients had died, and these were all found to have died. Now, that is very disturbing. Clearly, or more than likely, these patients didn't all die at the same time, so some of them must have been dead for a while. And nurse was clearly distressed that this had happened, and she felt, I think, possibly a little bit guilty that she had just found these 3 patients dead and hadn't realised until lights went on.
Graham Garner teaches photography at a Manchester school. Last April, he regularly visited Stepping Hill to see his mother, who was in another ward where Pink worked.
The nurses themselves do a wonderful job on the ward, but they're working under a terrific strain because there aren't enough of them, and those at night have a terrible responsibility of looking after so many patients.
One night he was at his mother's bedside.
And I was looking across at the opposite bed, an old man with an oxygen mask, and he was struggling with it. It kept slipping away, and he was having great difficulty with it. So I went across and adjusted it and helped him a bit and went back to carry on talking to this lady. About 10 minutes afterwards, I looked at this man and I thought he looked very pale and realised he'd died.
Severe pressures on nurses' time are not a monopoly of Stepping Hill. Nurses at the Royal London Hospital, Mile End, work in a new, well-equipped unit which also takes seriously ill old people. We talked to a consultant about one patient.
At a particular point, she and the nurse who was looking after her both realised that they wanted to talk about her impending death. The nurse had substantial other duties to deal with at the time, felt that she needed to do more than simply squeeze the lady's hand and move on to the next person, but equally didn't feel that she had time and felt too pressured to actually give the 15 minutes, 20 minutes, 30 minutes that it would have taken. And she told me this and said that this was part of what was causing her frustration in her day-to-day role as a nurse. When I find that there are only 3 nursing staff on for a night shift on a ward with 24 patients, and I know I've admitted 4 new admissions to that ward that evening, then I begin to wonder how on earth are 3 nurses going to cope with 4 new admissions, all of whom by definition are acutely ill. That's why they've come into hospital.
Might the answer be not very well?
I think the answer might indeed be not very well. Equally, the answer might be run ragged, blue-arsed fly, and coping just.
Grahame Pink says when nursing staff at Stepping Hill are free to attend to patients, they care for them very well. But at night, there were sometimes only 2 nurses, and when one was elsewhere, the remaining nurse had to handle sudden emergencies.
I was on C5 on my own. It was about 1:45, and the auxiliary lady was on her break, so I was completely alone with a ward full of patients. I had 1 patient on the commode already behind 1 set of screens. I had another patient on the commode here, and I was called. A 3rd lady wanted me. I brought the commode, I pulled the screens round, went behind the screens, and was moving the lady who had had a stroke, was obese, very heavy, very difficult to move, but I had to get her onto the commode. I was moving around and got her onto the edge of the bed, and as I was doing this, I heard footsteps. Someone was going out of the ward. Clearly, I knew no one had come in. One of the confused ladies was going out of the ward. Steep flight of steps just outside the ward door. What was I to do? I decided the best thing was to leave this lady, because even if she fell on the floor, the chances were she wouldn't die, she wouldn't have such a serious injury, and go out and get hold of the lady that was out there and try and bring her back into the ward. So it was a very distressing business altogether.
Could you not have got more help?
Well, this is what I've been asking for. I've been asking for more help for the last 12 months. We don't just want help on each individual occasion. We need somebody there all the time. You never know when these incidents are going to occur. They can flare up in a matter of moments. We need somebody there all the time. Just to say, pick up the phone and we'll send help, that's no answer at all. That's a sham.
We asked about this issue at the Royal London Hospital.
Are there enough nurses to prevent, for example, patients wandering out of the wards?
In short, no. On the ward at the moment, I have a lady who is prone to wander. We certainly don't have sufficient nursing staff to monitor her every movement and make sure that she's engaged and not wandering. I have had patients who've turned up as far away as Heathrow.
For Grahame Pink, now aged 60, nursing the old is the end of a long and varied career. In the 1950s, he spent 3 years as a registered nurse, then left the profession, and for over 25 years was a school teacher. He came back, and in 1987 began work at Stepping Hill.
You need a great deal of patience, but although the worries and the stress are great, the rewards are sublime. These people that we're looking after, these are people who have served their families. They are people who've put a great deal into their communities and in many cases into their countries. Some of them have served their country in the Second World War. And I think sometimes it's wretched that we cannot give them the care that they need.
Pink recalls a further incident at the hospital. He was occupied on one side of the ward when another patient called out.
She said, I want the commode now. I said, yes, I do appreciate that, but I'm sorry, you'll have to wait. And she just said she couldn't wait, and she started crying and said she'd have to do it in the bed. And I felt absolutely dreadful. I was humiliating and abusing this lady, and I said, I'm sorry, but you'll have to do it in the bed. And then I went back to the other side. It took us about 20 minutes to half an hour before we could get back, by which time this 80-odd-year-old lady had had to defecate in the bed and lie in her own excreta.
In East London, Professor Shah Ebrahim confirms that patients who summon nurses don't always get their needs attended to.
And that's because the nurse is elsewhere doing other tasks and can't drop what she's doing to come and deal with what the patient wants done at the time. So yes, it's quite feasible that a person could shout out and be in a bed that was wet for 20 minutes. Quite feasible.
Do you think that's something that we just have to live with?
I think it's something that I find difficult to live with. I would find it intolerable if I were a patient, I know.
We might have patients on a normal saline drip like this one here. They might be on blood. If they're on blood, they need observations every half hour. We have to take their blood pressure, their pulse, their temperature. Very important to take these observations because a patient on blood can react against it. Then the transfusion has to be stopped and possibly the doctor has to be called for. Unfortunately, we're not always able to do these observations correctly and regularly. We should be able to, but there just isn't time, so they do get neglected, and that shouldn't happen.
If blood transfusions are not monitored properly, can it be dangerous?
Yes, they can be. Particularly in the first phase of a blood transfusion, reactions can be common. Subsequently, one needs to make sure the blood is going through at the correct rate and that the transfusion hasn't finished sooner than you've thought. You also need to make sure that the needle is in the vein, so yes, monitoring is important.
In April this year, Mr. Pink allowed the critical letters he'd written to Stockport Health Authority to be published in The Guardian. Later, the authority issued its assessment of conditions at the hospital.
Most, if not all, nurses would like to see higher staffing levels. There is not the money to do more.
After Mr. Pink's criticisms, nurse staffing had been reviewed.
It is more than sufficient to provide adequate levels of nursing care.
The local Community Health Council, which represents users of the health service, says staffing on the wards was not at a desirable level. Standards varied between adequate and good. Pink and the authority agree that C5 ward has a minimum staff of 2. We asked outsiders about this. Some said on a quiet night it was enough. Others emphatically differed.
At night, are 2 nursing staff enough for a 20-bed acute geriatric ward?
Not at all. Geriatric wards in the middle of the night are busy places. The ward may have had several admissions that day of sick people requiring many nursing procedures, may have accidents to cope with, patients falling over. The net result is that by the time you take out the time that nurses are expected to be on break, are expected to write up reports, give reports, hand over, there's not a lot of time for hands-on nursing.
So it's not enough?
2 into 20 doesn't go.
We talked to Mrs. Jean Ball. A former nurse and nurse manager, she now does research on nursing standards. She's never visited Mr. Pink's wards, but based on his reports, she calculated how many staff were actually needed there. She used a system called Criteria for Care.
I looked at the database, looking at the average nurses required per care of the elderly patient in several other hospitals. And on the basis of that, I considered the 20-bedded ward needed at least 4.5 nurses per night, and the 28-bedded ward needed at least 6. And of those, at least 65% should be trained nurses.
Now, according to the Health Authority figures, on the 20-bedded ward, you can have as few as 2 staff on a night. And on the 26-bedded ward, there can be as few as 3. What do you feel about that?
Well, there has been some work looking at minimum staffing levels, and I would be very unhappy with anything less than 3.
Stockport Health Authority have issued us a statement saying that Criteria for Care can be an unreliable system.
I find that very strange for a number of reasons. Number one, it's being used in resource management sites where it's being used to cost nursing. If it was unreliable, it would have been shown by now. And secondly, Criteria for Care was actually developed in Stockport Health Authority.
Stockport is not the only northwest hospital where staff are spread thin. 6 weeks ago, the night staff of a geriatric unit at Billinge Hospital near Wigan sent management a formal complaint.
Current staffing levels are totally unrealistic and thus dangerous for both patients and staff.
Wards, they said, might have only 2 nurses on them at night.
If an untoward occurrence happens on a ward when the trained nurse is on her dinner break, leaving only the auxiliary nurse on the ward. Who takes responsibility for the occurrence?
Wigan Health Authority told us that staffing levels were set several years ago. The management, they said, is new. The complaint will be investigated. A government body has also sounded the alert. 5 years ago, the reports of the Health Advisory Service began to be published. The service visits hospitals to report, among other things, on staffing levels. In many areas, no critical comments were made, but in some, its language was blunt.
1987, Newcastle. Some staff become severely overworked and aware of hazardous situations from which they are unable to protect patients. Consequently, morale is very low. 1988, Barking, Havering and Brentwood. The nursing figures for night duty are below acceptable staffing levels. 1988, East Suffolk. Nurse staffing levels in some hospital wards are unsafe. 1989, North Derbyshire. At one hospital, the wards are overcrowded and staffing levels are low. 1990, Warrington. At one hospital, the levels of staff available at times fall below an acceptable level. For example, there are a few occasions when only 2 staff are available on a ward during the night.
The Health Advisory Service has reported low staff levels in parts of 8 other areas.
Yeah, do what you like.
Future staffing levels are likely to come under even more pressure. Over the current decade in Britain, the number of cases treated involving people over 75 is likely to rise by 1/3.
Right then, my love. Just feel a bit of pressure on your arm, okay?
Meanwhile, the number of girls leaving school, a traditional recruiting ground for nurses, is going down every year by about 3%.
Your words hard.
Yet in the 4 years from 1986 onwards, new central government money for hospital and local health services has gone up by less than 2% a year. An example from Glasgow shows how run down the service already is. The Greater Glasgow Health Board, unhappy at the standard of care it offers the elderly, has sold off this site to a private health company. The firm will build homes for 180 NHS patients. This scheme, in which the NHS pays the private sector to care for the old, is discussed enthusiastically at a healthcare conference at the Glen Eagles Hotel in Scotland. Laurence Peterken, General Manager of the Glasgow Board, gives one reason why the project has been undertaken.
There'll be a quality of care, which means they can have their meals when they want them, not when it suits the nurses to dish them out. Guaranteed number of entertainments and outings and so on. So single-storey accommodation, landscaped gardens, an enormous improvement over a lot of the things, poorish standards we have in the NHS at the moment.
Tell me a little bit about some of those poorish standards.
Well, I went on a visit to one of our geriatric hospitals the other day unannounced, and I must say I was absolutely appalled by what I saw. There was rubbish bags outside the door, old brooms and mattresses propped up against cracked windows, 30 patients in a ward, very poor day space. The only room to eat your meal is in the central corridor of the 30-bedded ward. All kinds of things like that, no patient call buttons, things where really, you know, it's nowhere near good enough for the elderly.
What effect do you think working in such rundown facilities has on nursing morale?
Nurses, I think, feel discontented. Nobody is at their best if they're working in a poor environment.
Turn the corner.
But no matter how hard-pressed nurses are, most decline to complain publicly.
Traditionally in nursing, we're taught not to speak out too much, that if we're not coping, then maybe there's something wrong with us, rather than something wrong with the setting in which we're working. And very often, when there is a problem, it is a technique of management to use that, to try and find something wrong with the nurse, rather than find something wrong with the setting. Another factor is that for many nurses, when they realise the implications of speaking out, both for themselves in terms of their job and career prospects, you know, will I get a job if I'm seen as a troublemaker? I think there is a feeling within the existing health service that people should be towing the party line, that you stay within budget, you do as you're told, and if you put your head above the parapet, you have to be prepared to have it shot off.
Grahame Pink, in publicly criticising his own hospital, has therefore chosen a lonely path. But he's an independent and self-reliant man.
Sometimes when I've been working for a whole week, it's lovely just to sit and quietly listen to some Mozart or some Beethoven. I try to get out each week if I can into Derbyshire or to the Yorkshire Dales and just get out, perhaps on my own completely, and have a full day's walking. One thing perhaps above all is that I think right must be done. If something is wrong, I want to put it right. I'm not going to just turn the other way and pretend it doesn't exist. I'm most likely in the very fortunate position that, having got a pension from my years of teaching, that I'm in a position to speak out in a way that possibly other nurses couldn't do, because they need the work and therefore they don't want to take any steps which they think would hazard their career.
When criticised, he knows how to present his case.
I was appointed a magistrate in 1985. It took about 12 months. I think they go into considerable detail about your background, and I think they have to be very careful whom they appoint. Having sat in court, I'm very much aware what the importance of evidence. It's got to be very reliable, it's got to be written down. So I have gone to a lot of trouble this last 12 months to put everything down in writing.
One way the health authority disputes Pink's dossier is to say that other night staff at Stepping Hill do not share his criticisms. They sent us a written statement by a night staff nurse. She said that in 11 years she'd never seen staff numbers fall below those required to allow safe practice. But she was not willing to be interviewed, and we were not allowed to talk to other night staff. The Community Health Council says some night staff they spoke to felt Pink portrayed the situation as far worse than it was. Mr. Pink says some colleagues at the hospital are sympathetic and regard the criticisms he's made as healthy.
They say, having been out of nursing for 25 years and then come back in, that I maybe have come back with fresh eyes. Perhaps now I see things that they don't see. Talking to one of my staff nurses shortly after the first article appeared in The Guardian, she was telling me that her husband couldn't believe what had been written, and said to his wife, "This doesn't occur, surely these things aren't going on." And she said, you know, when I read the article, I have to admit, yes, everything he's written is perfectly true, but I've never thought about it before.
In August, after further public comments about events in the wards, Pink was suspended. The authority said it would not appear in this film until the disciplinary procedure was over. After that, it would take part in a programme with a broader perspective.
He's now being seen as someone who has got himself into very deep water, may even be sacked as a result of the action that he's taken, or linked with it. Now, whether it's correct to say that Mr. Pink is being disciplined because of his complaints, or whether he's being disciplined for other reasons, the fact that he's now being disciplined at a time when he raised complaints about standards leads people to make link coincidences in their mind about what's really going on.
Mr. Peter Milnes, General Manager of the authority, told us,
Mr. Pink has not been suspended for talking to the press.
We understand the main charge is that in one of Mr. Pink's public statements he may have inadvertently identified a patient. The inquiry has been adjourned until next week. The result will be awaited by all those concerned about government policy towards the health service. The government has, as it claims, given more money in real terms to the service. More questionable is whether the funds allocated keep pace with rising needs.
Yeah. Yes. Okay.
Mr. Pink knows little of the figures that party politicians debate at Westminster. For him, there is one hospital and one issue.
My only concern, right from the very beginning of this and right up to this day, is to get 3 more nurses on our wards. That's all I want, and if I could get that, then I would disappear into the obscurity from whence I came.